Clark, go ahead and tell us what you'd like to tell us.
Yeah, well, my name is Clark Hansen, and I've been a patient with Dr. Smith here for about 4 to 5 years. I originally came here because I was suffering from extreme mid-back pain, lower back pain, and neck pain. I'd been in a skiing accident when I was about 25, and unbeknownst to me, the complication of that over the period of 20 years or so had multiplied to the point where my back was starting to fall apart. I was getting subluxation in my mid-back, which is my vertebrae were starting to grow together, and this is what was causing the extreme pain. Through several therapies that we've been through, we were able to alleviate that and stop the subluxation, so I am now basically pain-free in my mid-back, my lower back, and my neck.
How long did it take you to start getting results when you first started?
I started seeing results within the first 2 weeks. My first month was very intense therapy. I was coming in 3 times a week for the first 4 weeks, and 2 times a week for the next 4 weeks, and then every week for about a month. So within a 3-month period, I had gone from, on a scale of say 1 to 10, pain-wise, I was about 8 to 9, and I went down to about a 1 or 2 within the 3-month period. So I could mitigate the pain with ice packs, and I could resume my exercise routine that I had been doing. I could get back to doing push-ups and sit-ups and walking around and that kind of thing. Before I came in, I couldn't even sleep at night. The pain was so intense, but we were able to take care of that. And a couple of years ago, I had started to develop collapsed arches. I got to the point where I'm a very active person. I like to hike and I walk, and I spent some time as a wilderness ranger with the Forest Service, so hiking is a very important part of me. I got to the point I couldn't walk a half a block without being in serious, intense pain. I thought I was going to have to start using a cane or be an invalid in a wheelchair, and Dr. Smith was able to set me up with orthotics and some therapies on the foot. Within 3 or 4 months, I was back to hiking 10 to 15 miles a day if I felt like it, and I don't think anything now about going out and walking or hiking. That problem is completely taken care of.
So what would you tell someone who's a little bit apprehensive about starting treatment in our office?
We're all scared about going to the doctor, but I'd say just go ahead and go for it. The therapies here are not painful. There's no needles involved. There's no intense pain or anything like that. It's just adjusting the back and doing some of the different therapies that you have here. It's very painless, and it actually feels really good after you get the therapies done. Having your back adjusted, have everything get lined back up the way it's supposed to. The pain goes away. It's a very relaxing procedure, and they also offer therapeutic massages here, which is really nice. I've had a few of those in my day. It's a good way to spend an hour just totally relaxing and getting all the kinks worked out of your back.
Fantastic. So do you feel like it's been a good investment of your time and your money?
Absolutely, 100%. If I hadn't done this, I would be an invalid right now. I'm 100% certain that I would be in a wheelchair, not functioning, probably would have had back surgery by now. I had a sister who went through the same thing. She's had back surgery, and she is just totally messed up now. She has to be on pain medication all her life, for the rest of her life. Serious narcotics to mitigate the pain. We went through a similar type of thing, and I did the chiropractic therapy, and I'm on 0 medication. I feel great, and I'm fully functional.